Learners with asthma. What is asthma? Asthma is a lung disease that causes an obstruction or inflammation of an air passageway. What will happen is when a person suffers from an asthmatic trigger, the passageway will constrict or become inflamed. And as this happens, mucus will build up to clog the airway, and the person will struggle to breathe. Um, this tends to happen from allergic reactions. However, it could also happen from just it's unpredictable. Asthma cannot be cured, but it is manageable if the right steps are taken. So really quick, I'm going to show you a YouTube video to give you just a little more information on exactly what asthma is.
Asthma is a chronic long-term condition that can be managed but not cured. Asthma affects the airways of your lungs. It causes the airways to narrow and swell, resulting in wheezing and difficulty breathing. During breathing or respiration, air goes in through our nose or mouth to the upper airways, at which point it reaches the windpipe, which branches into two large bronchi to reach the lungs. The lungs are protected by the rib cage, which also contains the muscles that control your breathing. In asthma, the airways are oversensitive and easily irritated by certain triggers, called asthmatic triggers. Most people with asthma are described as atopic, meaning they have an allergic type reaction to external triggers, such as house dust mites, pollen, cigarette smoke, animal fur, and chest infections. However, for some people, the onset of asthma is unpredictable and may be caused by anxiety, stress, or even laughter. An asthmatic trigger causes the airway walls to swell and the muscles around the airways to contract. The airways narrow, and breathing through them produces a whistling sound called wheezing. Mucus is produced from the lining of the airways, which clogs up the narrowed airways further and causes coughing. This makes normal breathing more difficult, producing symptoms of asthma that can be mild, moderate, or severe and life-threatening, where hospital treatment is needed. The narrowing of the airways is reversible if the trigger is removed, or if the inflammation is treated medically. Therefore, preventative treatment is used and can be managed by the patient themselves. An acute asthma attack requires medical intervention, but the type of intervention depends on the severity of the attack.
So some of the characteristics of asthma is chest tightness, shortness of breath, wheezing, and coughing. Asthma is unpredictable, and attacks can happen at any moment, whether the person is just sitting there or is being physically active. Um, and not all people present the same symptoms in the same ways, meaning that a person could have more than one of these characteristics, could have just one of these characteristics, or the chest tightness might feel different to that person compared to another. Um, some of the causes are airborne allergens and pollutants, such as pollen, smoke, mold, and animal dander, physical activity, cold air, stress, and strong emotions, preservatives added to some foods and beverages, such as shrimp, French fries, and beer, and gastroesophageal reflux disease, or GERD, which causes stomach acid back into your throat. One important thing to note about these causes has to do with physical activity. It's recommended that you to help help with asthmatic triggers and to stop them is to avoid them. However, physical activity, you obviously don't want to avoid that because being physically active is the way to a healthy life. Some of the treatment is work with a doctor to develop a plan. Or, like I just said, avoid things that are asthmatic triggers except for physical activity. Another way to help treat asthma is to track it and keep a record of flare-ups and just the time of year when you might start experiencing more asthmatic triggers or asthma attacks. This will help the doctor and yourself kind of develop a more accurate plan and when you should really be worried or be watching out for these triggers. And then obviously medicine and an inhaler. Um, so treatment continued. There's long acting, short acting, a combination of both, and preventatives to help with asthma. Obviously, at school, in the office, they should have um, the students whatever they need to help with their triggers. Educational considerations. Asthma is actually one of the leading causes for student absences. Um, so there should be a plan in place, such as a 504, which ensures that a student with a physical or mental disability gets proper accommodations. This will help with the student not falling behind in class and allowing the student to do what he or she needs to do to stay on top of things. The school staff should also be made aware of all asthmatic triggers and should have an action plan in place if a student does have an asthma attack at school. Um, for physical education class, or really anytime a student's going to be active or in the classroom, um, the teacher should know where the student's medication is, whether it's on them or in the office. It's very important that the right person knows where to get the medicine when needed because it can be fatal. And then obviously allow students to sit out or take breaks if he or she is feeling some triggers and some characteristics of an asthma attack. Um, and this right here is just kind of a form to help a teacher or student kind of develop a plan on how and what they need to do if a student suffers from an asthma attack. I just thought it was a cool chart and something that I would definitely put into place at my school. And that's it. Hope you liked it.